And I have had 3 specific patients who have, on the process of doing the consultation and diagnosis and then treating them for TMD, brought to my attention that they went to the point where the pain was so great that it went into their chest and they thought they were having a heart attack. Must have been pretty severe pain. 2 of those patients, all of them, not all of them were males. There were 2 males and 1 female. 2 of them actually went to the emergency department and did a thorough examination workup for a heart attack for that particular problem, and were cleared completely, and eventually the pain went away. So how can TMD mimic a heart attack? Well, that's pretty easy to explain. Pretty easy to explain. And that goes back to an old slide that I've showed many times on these episodes. And that's why I explained at the beginning how this thing called joint splinting works. When the signal comes back through the autonomic system to tighten up the muscles of first mastication and then the neck muscles and specifically in and around the scalene muscles will get tight and squeeze on the brachial plexus. And that is why in some cases, not all cases, but in some cases, when enough pressure, and of course everybody's anatomy is a little different, but when the neck muscles, called the strap muscles, scalene anterior and posterior, squeeze the brachial plexus, and it causes arm, hand, finger tingling and numbness. But as you can see in this slide, there's also a branch of the brachial plexus that comes down here to the pectoralis major, right here, big old muscle. And everybody that works out, they're trying to get their pecs tight, you know. So, but the point is that, you know, when the signal comes through the central nervous system, it always doesn't go to the same place, and it can be bilateral, it can be ipsilateral, and you know, it is unknown as to the particular nerve itself that's going to be affected. But we've had now 3 examples in this practice within the past 3-4 years of patients who swore that their chest hurt so bad that they thought they were having a heart attack.
Ask your dentist if they are a TMJ services provider.